these progesterone creams and any of these natural hormone treatments, they're put on the skin. Are they absorbable? I mean, does it really get into our body, or is it just making it slippery?
You know, I got that same comment from a gynecologist who was yelling at me for prescribing these things. And when I called him on the phone, he told my patient that. When I called him on the phone, I asked him if he checked levels of Provera that he was prescribing for his patients. And there was a long pause, and he said, no, there's no way to check levels of Provera. Well, I told him in my patients, I check pre and post levels of progesterone. I check a pre-level before I put them on it. 2 months later, I'll have them get another blood draw and check a post level. And you can clearly see that the creams are being absorbed through the skin because the levels will rise.
So there's no way for us to know if you're taking the synthetic form. There's no way for us to know if our levels are improving or if it's doing any good at all.
There's no levels to check for Premarin. There's no levels to check for Provera. These substances are toxic. They need to be avoided. You can properly monitor bioidentical hormones through serum testing. Some doctors monitor it through saliva testing.
So serum testing, that's through the blood?
That's correct.
Okay, is there any particular day of the month that you're best in treating or best in testing for progesterone?
For menstruating women, I generally have them check it on day 20 of their cycle. If they're not menstruating, postmenopausal, really any day of the month is fine to check their levels.
So the women that should be thinking about progesterone cream are the women that are suffering from things like, is it PMS? Is it problems getting pregnant? Because it's just absolutely baffling to me, the women that I know now that have problems conceiving.
So women with mood swings, infertility, PMS, heavy bleeding, these are some of the signs that you can think about progesterone. But progesterone's also been shown to protect against cancer of any sort. So in our toxic environment with our overload of toxic chemicals that stimulate all the estrogen receptors, most of us, men and women, could use a little bit of natural progesterone.
So, and it also has a calming effect on the body, doesn't it?
Absolutely. Progesterone helps calm anxiety down. It helps people sleep better at night. And again, I've used progesterone in men and women for over 15 years with good results. So
tell me, is it safe for us to go into the health food store and kind of take our health into our own hands and buy progesterone cream in any health food store?
I don't think that's the best way to do it. The best way to do it is to work with a practitioner that's knowledgeable about these things, to get your levels checked before you start taking it, to get your levels checked after you've been on it a period of time, and to not try this on your own.
Yeah, it's always best to work with a practitioner when it comes to things like this, because you can monitor through the blood before and after.
You need an independent person to be looking at you and to help guide you on where to go with things.
Now for those that are going to buy it at a health food store anyway, because there's going to be people out there that say, well, I've been on it, it's helping me, I'm going to stay on it. What are some of the things that they have to look for if they're buying it in a health food store?
If you buy progesterone in a health food store, I suggest looking at the label, make sure it says USP grade natural progesterone, and make sure there's no added ingredients that you can't read the words of. You should be able to read the words of all the ingredients on anything that you're applying to your skin.